can get started now. We're recording, so welcome to both of you. My name's Liz Buckley. I'm the course coordinator for the Bachelor of Public Health, which means that essentially with the help of Student Admin Services, who you will meet today, we manage the degree essentially. So now I'm not moving on. There we go. Okay. So welcome. This is our orientation session for the mid-year commencing students for the Bachelor of Public Health. And as we begin, I'd like to acknowledge the traditional owners and custodians of the lands on which we're meeting today, but also on which the campuses of Flinders University are located. Flinders University campuses stretch across the central corridor in Australia, so there are many lands on which we have campuses, so we'd like to acknowledge their elders past, present and emerging. So today's session is really about making sure you have the essential information to get started in your studies here at Flinders. So I'm going to go through various information that will get you started, and then you'll meet some of the people that will help administer your degree but also teach you about public health. So first things first, it's important that you have access to the systems at Flinders University. So if you weren't aware previously, there is a Wi-Fi available across Flinders University, and in fact all universities in Australia and internationally called EduRoam. Sorry?
And libraries too.
Oh, okay, there you go. To access EduRoam, you need your FAN, which is your Flinders
access number
or access name, maybe, could be. It's essentially your username, and you need your password. Now you can activate your account and get your FAN through the student website, the Getting Started page on the student website. So if you haven't already done that, it'd be important to get that done. These slides will all be available on the Canvas course site, so you can look up any information that you can't remember from today later if you need to. There is, on the Flinders Uni website, there is a new student section of Campus, which gives you the links to enrol in all your classes. It's not, the feedback I've heard about enrolling in topics is that it can be a bit confusing at times, but we do have, there is information and instructions on the new student section. I thought we had some information here, but there are instructions and it's relatively simple to follow those, but if you do need some additional support, you can ring the 1300 number there for Flinders Connect, or you can email them or go to their website as well. The range of topics that you'll find to enrol in covers the whole course, the whole degree. So it can be useful to have your study planner open at the same time just to see what order you can take them in, so that you're doing the first year topics first, followed by second year and third year. There's no requirement to necessarily follow it exactly like that, but it is recommended. If you haven't already got your student ID card, this can be something very useful for you. It can give you access to student concessions on public transport. It helps you to borrow from the library. You can load credit for photocopying onto that card, and it's available through the campus site as well. There's a direct link there to order your card. Hold on to it tightly, because if you lose it, to replace it, there is a small fee that would be incurred. I think it's about $10.
It's exactly $10.
It's exactly $10, yes. Okay, here are the instructions about enrolling and registering in topics and classes. So you need to log into the student system and select the My Enrolment tab. You agree or check the declaration checkbox, scroll down to the topics that are available for you, and then select the topics that you want to enrol in, and don't forget to save the changes. Sometimes if it's a large topic, you may need to register in classes, and again you can do that through the student system as well. At Flinders we use an online learning environment that we call Flow. More generically it's referred to as Canvas, and you'll find all your teaching content delivered through Flow. If you haven't used Canvas before, there are some courses available, I think it's through the library, where you can learn how to use Flow. To access Canvas, you can just go to that link there, and all the topics that you've already enrolled in should be available to you now. What else was I going to say about Canvas? I think that's about it. Yes, but if you haven't already used Canvas, then enrolling in one of the online courses through the library, Passport for Canvas, can be useful to make yourself more familiar with it. There's also some sessions available through your orientation planner, where you can look at, which is an introduction to Flow, and also textbooks. And you can enrol in those now. At Flinders we have a lot of parking available for cars, bikes, motorbikes, but you do need, for cars, you certainly need a parking permit, and you can apply for a parking permit through that link on the top left, and there is a student rate available for paying for that parking permit. There's a lot of public transport available to Flinders. Even though it's located south of the CBD, there are plenty of public transport options. So you could catch the bus, which is about 40 minutes from the CBD. It's even faster by train, and you catch the train to a little bit down the hill to Flinders Medical Centre, and then you can catch one of the Link Loop buses up to the main campus up here, and it's quite a fast trip from the CBD via train. And then there is the Loop bus, which is a free bus service that links up all of the campuses, and there is an app around that provides a timetable for that, called Bus Minder, so you can find out all the information you need for the Loop buses.
You have QR codes for the app as well.
Yeah. I know a lot of academics use the Loop bus because it's very handy to get between different campuses, whether it be Sturt, down the hill at FMC, Tonsley, or up here at Bedford Park, so it's really handy. The library is where you can find many resources available for the assignments that you're going to need to submit, and there are also resources available in terms of putting those assignments together, so developing writing for assignments, searching for literature and all of those kinds of things. They run a lot of different drop-in sessions, and for example they can show you how to find the relevant literature that you need to inform your assignments, and all of the information about the drop-in sessions and the resources available are on the library website. So the library is one of the main links that you'll find on the home page of Flinders. It'll be in the top right hand corner. I use it all the time because the library is a great resource of information. The library branches at Bedford Park are open 24/7, and there's staff available there during business hours.
However, with that, although they are open 24/7, you do need to get security to give you access on your on your student card,
Yes.
which a lot of people do not realise and then end up not being able to come in. So, yeah, from 5 onwards, you'll need your student card, and on weekends as well, and public holidays to get into the library. You'll need your student card, and have permission from security to get in.
When did you get permission from security?
I can
Beforehand?
Yeah, do you have your card yet?
No, not yet.
Well, afterwards I'm doing a small tour thing, so I'll show you where you can get all that done.
Yep.
There are a number of scholarships available for students, including undergraduate students at Flinders, and they cover a range of different criteria. So there are scholarships available for many, many different students who come to Flinders. So I'd encourage you to look at this website just to see if there are any that you are eligible for. They don't necessarily relate to academic performance, but there may be other criteria associated with them to make you eligible, but certainly something that's worthwhile looking at. Safety is a really important part of university life, and at Flinders we take this very seriously. If you experience or witness any behaviour that you consider to be unacceptable, it'd be highly valued if you could make a confidential report about it. There are links available to do this. It's important to note that making a confidential report isn't the same as initiating a complaint, but it is the first step, and information will be made available to you about what you can do next. So it's important to keep this in the back of your mind, because without the university knowing that incidents are occurring, then the university can't take any steps or actions towards preventing them in future or managing that particular situation.
Could I add something with that one as well? Sorry.
Yes.
I know a lot about it.
Please.
So with security as well, if you ever are studying later at night and you have to go down to, say, the train station or even the other bus station down at the medical centre, the security, if you call the security or go to the office, they will happily drive you there.
Yep.
Free of charge.
Or walk you to your car,
Yeah,
it's
walk
in the
you to
car
your car,
park.
anything
Yeah,
like that
all
as
you have
well,
to
yeah.
do is call them. Yeah.
Yeah.
All of the information that I am talking about today and more is available on the student website as well. So you just have to find the links and follow through. There are health, counselling and disability services available for students on site, on campus. You can see medical professionals, allied health professionals, counsellors, disability advisors as well, and you can also access self-help resources. In terms of the health clinic, all eligible consultations with students will be bulk billed, so it can be a way to access some free health services as well. If you are a student that does have a disability and needs to find out more about getting a disability access plan, which can help you negotiate extended timelines for assessments, etc. with your topics, then the disability services can help you navigate that process as well. So it's not just about health and medical services, but also about wellbeing services as well. So Oasis is the Student Wellbeing Centre at Flinders University. It is present on Bedford Park campus. It provides a range of amazing services for students. I have another slide coming up. I think it talks about the, and I know this is a favourite of Jamil's, is the community market, which has a range of goods, groceries.
Essentially free bread and vegetables.
Yep.
A lot of that's actually grown here at Flinders at their community gardens that they have.
Yep.
They also have a lot of low cost pantry items. So when I say low cost, I don't think I've seen anything there over $5. The majority of stuff you can get rice or pasta for 50 cents for a relatively large bag, so it's pretty good deal.
And that community market, I don't have
Every
Thursday? Yeah.
11 till 1, I want to say.
Yeah. So Oasis is located just above what I call the what is that thing? No, the coffee. But what is that? It's in a container.
Oh, yeah.
Shipping container. So there's a shipping container just up above and beyond the library. And Oasis is just beyond that. So it's a great place to make some social connections as well. There's a volunteer program, there's walks that you can do, there's a lot of facilities available there so you can meet with friends and other groups as well.
There's also musical instruments there if anyone plays. It's a good spot to do that too.
We have international student services as well at Flinders, and they are your first point of contact for international students coming in to study with us. They help you navigate arriving in Adelaide, and because it's a big deal coming from overseas to study with us here in Adelaide, they help you orientate yourself around the campus, but also local services around that you may need to access as well. They have a lot of social activities, so you can make connections with other international students as well. And they are there to assist you in your studies throughout. So if you need to ask them to help advocate for you as well as an international student, they can help manage that process as well. There's a range of other services available as well. So we'll be having Mel talk to us about student success and wellbeing advisors. There are prayer rooms available, conversation groups, equal opportunity advisors. We have a Pride network and the Good Vibes experiment. So there's a lot of things that can help meet the needs of a wide range of students here at Flinders. So how do you make the most of orientation here? Probably one of the first things you can do is log into Flow and enrol in the Finding Your Way at Flinders topic. So you could just search for that in the search engine there, and it will help you become familiar with Flinders, how the university works, some of the systems that are available here, and help you develop some skills to navigate your way around Flinders and to support you during your studies. There's a range of videos there and you can find links to support services, many of which I have mentioned today. So this week is orientation week, so it's about finding your way around Flinders, finding the information that you need to commence your studies. There is a welcome hub, there are campus tours. Jamil has kindly volunteered to take you for a walk around the campus to show you where many things are, including security, the library, who I'm sure he'll point out Oasis. There are ready to go sessions which can help get you ready for next week. There's the intro to Flow and textbook sessions as well, and a range of different social activities. Next week is called Connect Week. It's the first week of your teaching delivery next week, and it's also about making connections for you at university that will see you all the way through your time here. There will be a range of activities there, quiz nights, comedy shows, picnic games, meditation, a whole range of things that will that will hopefully meet your interests and needs, and a great opportunity to connect with other people and students studying here at Flinders. There are some key dates that you should be aware of. So the first one being O Week this week, next week classes start. There are a number of critical enrolment dates that you should be aware of. The 2nd of August is the last day to enrol in any topic, so that's in week 2. The census date is in week 5, so this is the date in which you can withdraw from a topic without incurring any or required financial contributions. So if you don't want to continue in that topic, that is the date to let the university know, and then you won't have to pay for that topic or the student contribution for that topic. There is the last day to withdraw without a fail, which is in week 9, the 4th of October as well. So these dates, all the critical enrolment dates, all the important semester dates, are all available on Compass, the student website as well. Top tips for starting at Flinders: become familiar with Canvas or Flow, the learning management system, and I've already told you about how you can do that. There is the Ping newsletter. It's an all-student across the university newsletter that will send out information that's relevant to all students who are studying at Flinders. There's a few social media accounts that you can follow, and then you could also consider joining the Flinders University Student Association, so FUSA. You will see them probably up in the hub this week. They've got a range of activities going on. A lot of them, I think, are wearing orange, I think it is today. So you'll be able to easily spot them. My top tip would be don't be afraid to ask for help. Everyone here at Flinders is willing to help you. If you have any problems, any queries, we're all keen to answer them. Your topic coordinators can help you with queries around your topics that you're studying. As course coordinator, I can help you with questions around the program itself and certainly student admin services. There are people here to help with wellbeing and student success, and there are a range of other people who are really keen to help you. If you are looking for specific support, then there's a link here from the student website as well around support that's available. And now I will hand it over to Mel.
I think I have to use the mic, don't I, for the
Yes,
recording?
please.
Hello. Oh my gosh, there's so many of you. Yeah, my name's Mel. I'm a Success and Wellbeing Advisor here at the uni. My colleague Anna's on the photo, and we've got one missing who will hopefully be joining the team soon. They interviewed yesterday. My job is to support the College of Medicine Public Health and the College of Nursing Health Science students when life gets a little bit wobbly. So we know that you don't study here independently of everything else that's going on in your lives. And we know that sometimes university needs to take a back seat when things can get challenging. So if they do become challenging and you're not really sure what to do, you know you might need some help to kind of get back on track at university, but you're not sure who to ask or where to go, you can come and have a chat with me and I'll try and help you break down any challenges or barriers to getting back to uni or being able to maybe be more present at uni. And hopefully link you in with some university services. As Liz said, there's loads of services here at the university and it can get really overwhelming about who to go to and what to ask. And so if you're not sure, then I can help you with that. Our team also helps a little bit around motivation and planning. So if you're finding that you're always running up to a deadline and you're not really sure how to use your time better, or if you get partway through your degree and kind of maybe a little bit apathetic or not really sure if you chose it for the right reasons or not really sure if you're going to get the career outcome you wanted, then we can help you kind of talk that through and hopefully support you to find your way through. And we might also link you in with the careers team and things like that. As here, we can connect you with other services, so we might be having a chat and I might say, oh look, have you thought about speaking to a counsellor about this? Or, oh, you might qualify for an access plan with disability services, and I can help you connect in with those services. And then this one, the most important, if you remember one thing from what I'm saying today, it's this bit. In week 3, you'll get a text message and it'll say, how's life going at Flinders? Reply 1 for an email, reply 2 for a phone call. If you've got any questions whatsoever, anything troubling you, anything you're bothered by, just respond to the text. Anna and I will try to call you or email you depending on your preference and try to just point you in the right direction. So we do that across the board for the whole university, so every student gets that text in week 3, 4 or 5. And it's not spam, I promise. Everybody thinks it's spam, but it's not. But yeah, and also I work very closely with people like Liz and with your topic coordinators, and so if life does get really challenging and maybe you're not coming to classes or you're not submitting assignments but you were doing that before, your topic coordinator might call me and say, oh look, can you reach out to this person? They were really present and now they're not, and we're worried that something might be going on. So I might give you a call and see if we can help you at all. Okay?
And next we have Tess.
Hi, both. My name is Tessa. I'm an enrolment and course advisor for the college. I do have a colleague, Kelly. She wasn't able to make it today. I am part of the Student Administration Services team across the university. I've also got my colleague Sam here helping out, which is fantastic. We aren't just located in this college, we are across the university, and as it says up here, the SAS team as a whole is involved in enrolment, assessment, student finance, teaching support, examination, graduations and a range of other things. But Sam and I work in the college, and we support students in all of the degrees associated with the College of Medicine and Public Health. And while up here it says that we're passionate, it goes beyond that. Our whole job is to help students within this college thrive in their degrees. And we are here to support you in every aspect of your studies, however we can. And so on the next slide, this talks about where we're located, and it's important to note that you can contact us or come and see us whenever you feel the need to. We are located just down the corridor a little bit, just down that way, and the front office and where we are located is open from 9 a.m. until 5 p.m. But if you are wanting to contact us outside of those times, certainly recommend sending an email or submitting an Ask Flinders request. You'll see the suggestion to contact via Ask Flinders request the most preferred way for students to get in contact with us. It's the easiest way for us to be able to take the time to have a look at requests and make sure that we are providing as much information as possible. And on that, when you are contacting us via email or through an Ask Flinders request, we ask that you provide as much information as possible. So that's not just your student ID number, your FAN, your personal details, including your name, but also the reason why you are wanting assistance, because that means that we can provide you with the best advice possible in the most effective manner. In saying that, it is also okay to get in contact with us if you don't know what you need, but you feel something is wrong. So if things aren't quite working how you want them to, or you're coming across issues with your study plan, anything like that, you're not sure exactly what the issue is but you want to get some help, you are welcome to contact us. It might just mean that there is a conversation involved as opposed to an easy answer. Both are perfectly fine. So as it also says up here, providing as much information as possible is fantastic, but do please be patient with us. We will respond as soon as we possibly can. We don't work on the weekends, so there may be a slight delay if you are contacting us late on a Friday, for example. We do also ask that students keep their contact details as up-to-date as possible on the student system. That makes it easier for us to contact you as well. I have said it before, but I will say it again. Please do contact us if anything happens. The earlier that you get in contact with us, the easier it is for us to resolve the situation. We have documents that we use called study planners, which map out a student's topics across the degree, and we are able to provide that for students commencing, but also continuing, looking at the topics that students have completed and what's left. And we can provide that at any point and as frequently as you would like that information to be updated. So we are a resource that is here for you to use whenever you need us.
Thank you.
Oh, sorry, I got
That's okay. Yes, I highly recommend Tess and Kelly, but also Mel and Sam. They certainly make my life easier in student admin services, and I can absolutely recommend Mel as well. I know she makes real differences to students. Okay, so the next session, or part of this session, is introducing you to some of the academics that we have here. Unfortunately, not all of them could attend today because of illness and also some unavoidable scheduling conflicts. So I will introduce some of them myself. The first one we have is Dr. Joshua Trick. He is an academic who has quite an extensive background in tobacco control research. His background himself is as a behavioural scientist and a population health researcher, and he loves public health because it is the Swiss Army knife for tackling tricky social issues. He's worked in a range of different roles and is moving or transitioning into or has transitioned into a balanced academic role. So he's actively involved in research as well as teaching. So you will come across him in the Introduction to Qualitative Research Methods topic, not in your first year, but as you go through your degree. Otherwise you may see him around campus as well. And the next one is Dr. Cheryl Shellbuck. She couldn't attend today but has provided us with a recording, which I hope I can make it work.
Hi everyone and welcome to orientation. My name is Cheryl Shellback and I am a topic coordinator for a number of topics in both the bachelor's and the master's courses in public health. I thought I'd do something a little bit different today. Instead of spending too much time talking about myself and my background, so you can see, I've got a picture of my family there on the left, and we can see the, CV-based information, so you can see my qualifications and my work history. Instead, I thought I would tell you a story about my apple tree. I love stories. I love hearing them. I love reading them. I love talking about them. It just seems to, make things a little bit more fun, a little bit more enjoyable, a little bit more memorable. I will say, though, this isn't a particularly thrilling or interesting story, though, but I do think it does, still serve a purpose. So my little apple tree there didn't always look as it does now. In fact, so many years ago when, so a couple of years after I first moved into my house, there was this strange twiggy looking thing in my front yard. And it was quite small, hadn't seemed to have grown. There were a few leaves on it. It just really didn't look very healthy at all. And one day one of my friends said, "Oh, is that an apple tree that you've got growing there?" And I actually had no idea. But having a young family at the time, I hadn't prioritised removing it either. And when she said that, I thought, oh, maybe I should look into that. So I started, doing a little bit of investigating, doing a bit of digging with those resources that I knew I had access to. So in this case, it was good old Google, and then of course, like some photos and a trip up to my my local nursery, and based on that, those preliminary investigations, I thought, yep, I think it could be, it could be an apple tree, and from there, I then started trying different things to try and get it to grow. And, and slowly after trying different things and different approaches, surely it did start to grow, yes, in a bit of a strange way and not, not uniformly as well. So you can even see now it's still taking on a bit of an odd shape. But it did make progress. And then one year, it was very exciting. I actually started to get some little apples. And I got very excited and thought, yes, I'm going to make myself an apple strudel with these, from apples from my own tree. The problem I hit though was that they stopped growing, so they remained really tiny. But more importantly, they just stayed really, really hard. They were so hard, in fact, that even the possums and the birds didn't touch them. They were really not good for anything. They weren't edible. Maybe the only thing you could have really done with them would be to use them as golf balls. Um, they were just, there was nothing you could do with them in that state. So from there, I went back to the drawing board and I started researching again. So again, looking at Google, going into Bunnings, going into different nurseries, talking with different people, and I started trying different approaches. I started like thinning out parts of the tree. I started, cutting off leaves in, sort of strategic ways. I started thinning out apples like in the next season as they started to grow. I tried sort of applying different products to the soil. And I don't know if it was just a timing thing or if it was a reflection of anything that, any of these interventions that I had been doing, but eventually the apples actually started growing to a proper size. At that point, I then had a new problem. And this problem was because they were actually now nice apples, the possums started eating everything. So I again started trying different techniques and couldn't get these possums to stop eating my lovely apples until it was actually only a few months ago. A friend of mine told me about this spray that she used. So I tried that, and yep, hallelujah, the possums don't like this spray. So now I have apples growing on the tree. The possums aren't getting them. You'd think that would be great. Almost there, but not quite, because I actually don't really understand when is the best time, the right time to be picking the apples. So again, I'm going through like a bit of a research and trial and error phase, trying to work that part out as well. So why am I telling you about this saga with my apple tree? The reason is, I think this is actually there's a lot of similarities to this and studying. So when you're studying, it's not all smooth sailing. There are going to be unexpected bumps and issues that are going to come up. And it's really important for you to be aware that this is going to happen, but also aware of what resources you have around you to help you, or to help you help yourself. And so, for example, there could be academic issues that come up. So, there's, for example, we have, the SLSS, Student Learning Support Service, that can offer services there. There could be personal issues that you face. So, we've got health and counselling that can offer support for you as well. And there could be a myriad of other things. I guess, the message I've got is you can see that, from this little one-page PowerPoint slide, I've got a number of qualifications and I've got lots of experience in lots of different areas. But despite all of that, I am still very much learning things, and I'm still very much going through that process of researching, using the resources that I have around me. So making sure that I'm familiar with what those resources are, and and then going through this trial and error process. Some things work and some things don't. Some things are expected and some are not. I think the important thing is to keep on moving forward, with what you've got at your disposal, and always seeking out more information. Best of luck, everyone, and I look forward to seeing some of you in my classes.
very wise as Cheryl. And she teaches one of our third year topics. The next person that I'll introduce you to is Dr. Amy Hickman. She divides her time between here in Adelaide, but also up in Queensland. So she's up in Queensland at the moment. So she has also sent a recording to introduce herself.
Hi there, my name is Dr. Amy Hickman, and I'm a senior lecturer in public health and also course coordinator of the postgraduate public health programs here at Flinders. I wanted to tell you a little bit about my journey and how that impacts what I do here teaching into the Bachelor of Public Health program. I began my career in nursing in Boston, Massachusetts, in the United States, and was really involved mostly with adolescent medicine and with medical intensive care. After some time and years went by, I had a family. You can see my beautiful children and husband there in the center of the slide. But as they grew older, I decided to bring together my love of writing and communication to my study and my experience as a nurse in the United States. So what was really exciting to me was understanding how everyday ways of knowing about health and disease and the body intersected with expertise in those areas, medical expertise in particular. So I began to develop with a community health worker a participatory research project. And we explored together really the how of strength-based health education strategies and also decolonial ways of working with community to support health and well-being. So I learned a lot from this particular promotora, and it really shaped how I approach my research and my teaching here at Flinders. So I think one of the ways that it really impacted me was I learned a lot about how to reflect on my experience, because I was working in kind of a cross-cultural context. The promotora I was working with was a Latina, very different standpoint than myself, and I brought a whole lot of assumptions with me, and kind of began to understand that I needed to unpack those and to be able to be aware of them, so that I could really do better work and to grow in that context as well. So one of the things I really enjoy about working in the Bachelor of Public Health program is I get to teach PHCA 3515 and 3516, which are our work integrated learning topics. And so I get to guide students to make the transition from university learning to learning reflectively from their experience in the workplace. So, and that's just, I just really love doing that, and it's really great to sort of see emergence of students learning that they can do work in the world that really matters, and I think that's just great. So currently, we have students at the Adelaide Primary Health Network, and a student at also NCEDA, which is our own National Center for Education and Training in Addiction. And we have several students also working in research contexts at Flinders. So it's a wide variety of things that are possible for you as you go along in your journey in a couple of years' time, and I really look forward to meeting them. Have a wonderful rest of the week in orientation. I wish you all the best. Bye now.
It was good to hear from Amy. Oh. And the next person we actually have in real life. So Associate Professor Billy Cambois. Billy, could you... What's that? A recording.
Hi everyone, my name is Billy, and My background is in economics and statistics, but this year I've been teaching public health for the first semester, and the second semester I'll be taking health equity. And so this will be introducing students into the concepts of equity, sustainability and social justice within the context of public health. I think one of the things that I'm looking forward to is looking at the drivers of health inequity, so social, economic, political, ecological, drivers, and seeing how we could implement interventions to sort of mitigate circumstances where you have health inequity. And so, yeah, I've worked in a few places. So I've worked in Africa, I've worked in the UK, and in Switzerland, and now here in Australia. And so I think it's a good experience that I've had, and I hope I bring to the topic as well. I think the most important thing is that I'm the shortest member of Bachelor of Public Health, topic coordinators, and so very easy to spot. So looking forward, to for those of you that will be taking the topic, looking forward to having you from next week onwards. Thanks, Elise.
Thanks, Billy. Now, Shahid also was unable to attend today, but he takes our biostatistics topic. So, Associate Professor Shahid Ullah, he is a biostatistician himself, so this is a second year topic, and a lot of people find biostatistics initially a little bit scary and daunting, but with Shahid leading you through his introductory topic to it, he takes you along that journey and shows you how important it is, and helps make it very easy to learn. Biostatistics is really important. It's the way we quantitatively summarise populations and their health, and the impacts of different interventions. But you will look forward to, if you don't meet him beforehand, you will certainly meet him in second year. Unfortunately, Kate Fairweather is under the weather and couldn't make it today.
Hey
so
everyone, I'm Kate Fairweather, and I'd like to share with you a little bit about who I am and why I love public health. I lecture into the Masters of Public Health program, so it could be that I cross paths with you later in the semester. So, who am I? Well, so I joined public health at Flinders to lecture in public health and health equity in 2022, so I'm still kind of settling in. I teach students about evaluation and program planning in a health context. But wind back a little bit, and so where I came into a university as a student was in Adelaide. I studied health sciences, but in the late 90s, probably when most of you were being born, I moved to Canberra and transferred to a Bachelor of Science at ANU. So my honours was in psychology while working as a research assistant in psychology at the Australian Institute of Sport, and then I transitioned to being a full-time PhD student at the ANU Centre for Mental Health Research. So while my first year of undergrad in Adelaide showed me how fundamental public health was to a whole host of interventions that were engineered to improve health and lower disease risk, it really wasn't until I began my PhD on mental health using epidemiological methods that I really got my teeth into how critical public health was to a functioning society. So epidemiological methods allowed me to understand health by analysing population health data. I was actually identifying distributions, patterns and determinants of health across a range of sub and general populations in my own research project. This was really exciting, and for me was quite a profound experience. So what do I love about public health? So it's really fab that you're interested in public health. This is because my experience has been that there is a super huge scope to contribute to a whole host of incredibly meaningful pursuits in a public health career. Now, for me, that was or has entailed working on really diverse, different research projects and roles, and that has include men's mental health and infertility, risk factors relating to suicidality, mental health in the Australian Defence Force, addiction, genetic and environmental factors involved in eating disorders, chronic health, chronic disease, self-management for people with severe mental illness, and more recently, neurodiversity and health. Now, all of these roles have been united around issues that are related to mental health, where my ultimate drive was, and actually still is, to support people's mental health and well-being. So finally, as my lectureship suggests, I am passionate about health, and that is a universal right for all. And acknowledging and incorporating cultural and population diversity is key in this. That is, different groups and cultures experience health in many different ways. So it's really vital to recognise and give opportunity for people to communicate what is health to them in a way that is meaningful and authentic. So as a collective, it's fundamental for us to strive to develop systems to deliver healthcare that reflects this. And evaluation is a critical enabler in this journey, as it queries whether what we do in health is working or not. Thanks very much. I will pass you over to Amy again, and I hope to see you around the traps. Thanks for having me on.
Thank you. Yeah, obviously we are reusing the slide from a previous session. So next I'd like to invite Associate Professor Jackie Stevens to introduce herself. We need to be careful with Jackie. She's just arrived from overseas. She could be jet lagged.
Is there a
Oh yes, there is. Oh,
no,
sorry,
it's
I don't.
Yeah,
there we go.
okay. Hi everyone, I am Associate Professor Jackie Stevens. I am an epidemiologist who's been working in South Australia for over 20 years across a number of organisations. So I worked for many years in SA Health, working in the surgical space, doing research on surgical improvement, and then also worked in the communicable disease control branch for many years as well, and across all three universities and currently here at Flinders. I teach the policy in public health subject, which you'll come to in your third year, in your last semester at the university. My research interests sit within the sort of rural and remote space, particularly looking at how people access healthcare who live in those locations, but with particular focus on how children and women navigate healthcare when they're living in rural and remote locations. And because of the nature of my work, it also sits across climate change and also how disasters and emergency events impact on people and their access to healthcare during those emergency events, and also how climate change is going to change their access to healthcare. As you might guess, as an epidemiologist, most of my data analysis is using large data sets, and I do a lot of data linkage, but my team actually does a lot of mixed methods research. So we do a lot of qualitative research where we go out to country and we talk to people about their experiences of accessing healthcare and how it impacts on their lives when they can't access healthcare. So it's quite a diverse space to be working in, but there's a lot of common threads, and it relates quite closely to some of the work that we do within the policy space that I teach into. because we need the data to influence the policy, but then the policies also influence how people navigate healthcare. So it's quite an important space to be working in. It has, I think, working in policy is and the reason I've come to being sort of in this space is that it's probably the biggest way you can impact the most number of people. Early in my career, I was working one-on-one with patients, and yes, I was having an impact on individual people, but I quickly realised that having a bigger impact for a large number of people was going to require that shift across into the public health space and working with either statewide or national data to influence policy. So that's sort of how I transitioned out of hospitals and into a more public health policy environment. I do lots of work with other overseas people as well. So yeah, I've just gotten back and I'm a bit jet lagged.
Thank you, Jackie. Okay, we're getting close to the end. So I've already introduced myself. I am Liz Buckley. I'm a senior lecturer in public health. I have, like many other academics who will be teaching you during your degree, have had quite a diverse range of experiences, professional experiences. I'm an epidemiologist. I would call myself a cancer epidemiologist. I'm really interested in how cancer impacts populations, but also priority population groups as well. And I think that's important because I'm really passionate about everyone having the same opportunity for good health, so speaking to health equity there. I'm transitioning more into the cancer survivorship space now, so how people survive after a cancer diagnosis and their primary treatment. A lot of people experience poorer health because of the cancer diagnosis and the treatment that they've received. I've worked in my undergraduate background is in medical laboratory science. So I worked in laboratories and at the bench for a number of years after I graduated from my degree, but then I moved into public health through undertaking health technology assessments. I've worked in the public service. I've worked at all three universities, all the major universities in South Australia, I will be teaching you for epidemiology in your second year of your degree, which I very much look forward to. We are starting to run out of time, but our last presenter, but not our least presenter, is Mr. Jamil Locker. He is your course representative. Thank you, Jamil.
Hello, did you put
Yes,
the
I did.
cool.
Sorry.
No, you're right. I haven't looked at this one yet. Can't need to remember what I wrote from last time. Alright, cool. So, first of all, a bit about me. I'm Jamil. I'm in my last semester as of now for my Bachelor's of Public Health. I came in from an alternative pathway, so I've actually been studying for 5 years straight. So I know a lot about studying and the stress and everything like that, and have spent a lot of time making connections to help myself and other students as well when they need to. So I know a lot of the people in the library. I've worked around areas around AI, academic integrity as a topic rep, and also through FUSA as well, the Student Association. And kind of for me, I came in from thinking I was going to be coming in through nutrition. So I did an undergraduate diploma of nutrition, thinking, I'm going to go towards public health nutrition. And the thing about public health is it's so broad that you have this kind of opportunity, unlike other areas of health, where you can kind of go into so many different areas. So although I came in thinking that's where I kind of wanted to go, I've since gone to, for a while I went into being interested in harm reduction and things like that, which I still am.
However, the big one for me since kind of the last year or so has been AI and digital health, which is my placement. So I'm looking at the effectiveness of AI wellbeing apps in managing depression for my placement, doing a systematic review, which is really cool. And yeah, now I'm just going to go through a couple of tips. Big one, I've seen it happen a lot with students where they're afraid to ask for help. The teachers here, the support systems, these guys, everyone, they want you to succeed. And asking for help early means less chance of problems down the line. And that's something that a lot of people don't do. I've seen people have to leave the university. I don't know if I've seen many people in the Bachelor's of Public Health, but other topics certainly where they were afraid to ask for help. And because of that, everything just caught up with them and they got to a point where they just couldn't continue. So ask for help and ask for help early. University is not just about studying, it's about forming those connections and like finding yourself, understanding yourself better. And I think that's something online universities kind of made it hard to do. So when you can come to the campus, there's so often there's events at places like the Tavern where I'll show you, and Oasis and other places where you can make connections, make new friends, join the clubs, because those connections not only might be able to help you in life later, but also throughout your degree, and they're just a good way to make friends. The big one for me, which I think is really important, is joining Horizon. So Horizon is Flinders' self-development program. They have little kind of couple of hour courses and some slightly longer day ones around like leadership. They're about self-development and also helping you get jobs in the future as well, securing them. So things like helping with resumes, elevator pitches, how to communicate, things like that. They're really important, all those soft skills. And it looks good on a resume too, which is another bonus. Joining the Australian Public Health Association, another really important one. They have a lot of events and a lot of different things that happen throughout the year, such as workshops and other things. It's about $60, I think, for students a year, but it's worth it because you get a lot of added bonuses, such as discounts to all the events, in some cases free, which is really good. I mentioned before, join clubs. There's so many clubs here, from ethnic clubs all the way through to chess clubs, music clubs, you name it, there's probably a club for it. And lastly, a bit related to the top one as well, is don't stress, try not to stress too much about stress out if you're not getting the highest distinctions, highest grades possible, though it's great to do. If it's stressing you out to a point where it's difficult, remember that peers get degrees, essentially. It's a joke, but it's true. In most cases, as long as you're passing, it's fine. Not saying you shouldn't aim for the high grades, but if you're struggling with it, remember that. And just enjoy yourself. That's something that a lot of people don't seem to do at uni anymore. Yeah, thanks.
Thanks, Jamil. And so Jamil will be one of your course reps, but so will Janet, who again was unable to attend today. Sorry. And you'll be able to find links to contacting them on the Bachelor of Public Health student topics topic site, course site in Canvas. And if that's not accessible in your dashboard or in your courses in Canvas, please let me know and I'll make sure I send through the link to you. So that's all the information that I have for you today. Thank you so much for coming, and I'm looking forward to getting to know you over the next few years. And if you have any questions, please don't hesitate to shoot through an email, come and see us. We're always more than happy to help.
Thank you. I'm happy to answer any enrolment questions you have now, if you have any. If not, off you go.
Yep.
Okay, good. I just wanted to double check. Yeah. Just wanted to double check. Yeah. Starting to panic a bit. Is it?
No,
Where is it?
don't
Yeah.
panic.
Cool.
It's just not released yet.
Yeah.
Been in
Yeah, so it's
It'll be out by the end of the week.
Yeah.
Yeah.